Excellent. Welcome everybody, and thank you for attending another one of our EPHA webcasts, and great to have Mike and Claire with us again. Thank you so much for giving up your time for this. I'm sure there's lots of questions that are going to come out of yesterday's government news report that they did, and then obviously the guidance that we've had. So if I hand over to Claire and Mike, thank you, and I'll leave it with you.
Great. Morning, everyone. Thank you very much, Harriet. Lovely to be here. Mike, are you okay if I say a few words and then hand over to you? Okay, great. So it's lovely to see you as usual. I mean, I will hand over to Mike because it's really, I think the discussion is for Mike, really. I just wanted to recap what happened yesterday. Because, you know, a lot of your questions, I'm afraid, are at the moment not going to have the answers that you're seeking, unfortunately. But we'll see what Mike says with regard to everything. So, you know, as much as I do, that the next stage of the roadmap from next Monday was confirmed. The key changes for education as a result of that. For your secondary colleagues, children, young people in the classroom will no longer need to wear face coverings, but the advice is still that staff and visitors, when moving around the school, particularly when social distancing can't be maintained, should continue to wear face coverings. Residential domestic trips can go ahead as of next Monday. And there's a lot of information in the advice and guidance around the risk assessments and so on and so forth around that. International travel is currently on hold now until September. So that's been put on hold until September. And with regard to gatherings, in terms of out of school, after school clubs and wraparound provision, the numbers can be lifted again in line with the guidance. But that will not align with the measures that schools are still required to undertake. So if you read the advice, it is still very much around, because of the need to contact trace, it is still very much around bubble management and groupings of young people, trying to keep bubbles apart and separated, staggered start and finish days, staggered lunch periods, if that's how you're managing things, and very much at the moment keeping individual bubbles separate as much as you possibly can. So again, whole school assemblies at the moment haven't been approved. And so on and so forth. So I absolutely appreciate, and we had this discussion at EPHA last week, that it does feel now that the easing of the restrictions in society is happening at a quicker rate than it's happening with the school. And we'll come on to that in a moment. A quick summary of the announcements yesterday. I'm going to just check with Alex to see if I have missed anything of pertinence.
No, not at all, but I have updated the summary document, which will come out in the comms as well. So
okay, thank you for that, really. So a lot of the questions that you sent through were around after the 21st of June, really. So at the moment, I don't know, and we're still waiting on, you know, what will happen as a result. Obviously, we're a step closer with yesterday's announcements, but I wonder if it's worth handing over to Mike at this moment, sort of from his perspective and his colleagues across the country's perspective about sort of the easing of the restrictions and where we're going in terms of the coming out of lockdown, Mike. So is it a good point to hand over to you?
Thank you. And thank you for everyone for inviting me today. I'm going to just do a bit of a blurt, a bit of a download, I think, because I'm finding it really, really complicated. So I suspect you guys are as well. So I don't think things are going to get any better than they are at the moment in terms of rates. The rates we're seeing at the moment in Essex are starting to probably creep up a wee bit, but they're still pretty low. So the rates at the moment are something like 14 100,000 per week. Now, to put that into perspective, in the worst bit of just before Christmas, it was 1,500. So we got less than 100th the rate that we had at Christmas. In addition to that, we've got large numbers of people who've been vaccinated now. Vaccination will reduce the risks for that individual of becoming unwell by between 80 and 90%. So not 100%, but between 80 and 90%, and probably about 5% of people at the end of the day won't bother getting vaccinated. There will be no herd immunity, and the virus will continue to spread within the population. So what does that mean for now? So as we remove restrictions, the virus will begin to spread again. At the moment, those people who spread the virus have not been vaccinated. Those people who suffer from the virus particularly have been vaccinated. That's a bit of a generalization, but broadly speaking, that's how it is. We don't know yet how well vaccination prevents the spread of the virus. There's some evidence it does slow it down somewhat, but these vaccines are not designed to prevent spread. The vaccines are designed to prevent harm in individuals from the virus. So as we get through, as we look ahead through summer into autumn, we will see a third spike. There's absolutely no reason we won't. The rates will go up. There will be nothing to stop the rates going up. So I think the position at the moment is about as good as it's going to get. We don't know when the rates go up, though, how many people are going to get ill. And we're not even going to know how many people are infected. And there'll be lots of people in the population who have the infection, but more and more of them will be symptom-free because they'll be vaccinated, but they'll still be spreading it around. And that has implications in terms of how we wish to conduct ourselves when we're like queuing or what have you. We wouldn't want to get closer than 2 meters to somebody if we could possibly avoid it. So the likely position will be that if the rates went up as high as they did around Christmas, and I can't see a reason either why they would or wouldn't, then we would expect to see hospitalization rates, because they will be people who go to hospital, of around 10% of what we saw at Christmas, so considerably lower. So even when this thing peaks, the chances are we're going to see about 10% of the people seriously ill that we saw previously. The question is, will it peak or will it just go up and up and up and up? And I think that's really hard. But if I look at what happened in Essex over Christmas, I think this thing naturally goes up and comes down again. And actually, if I wanted to map very closely the different tiers and restrictions in this thing that we in Essex were in, and indeed you can do this for Liverpool as well, there's actually not a lot of relationship between when the restrictions are put in place and when the reductions in cases occurred. So if one looks at the south of Essex, Epping, Brentwood, those places that are really badly hit, the decline in cases was already starting before lockdown in late December, early January came into effect. So where I'm going to with that is I think even without restrictions, the cases will go up and then the cases will come down again. And we won't see more than 10% of the hospital admissions we saw previously. The caveat for that is that we don't know what's going to happen in terms of variants. And variants is the real worry. The reason that Essex got really, really badly hit before Christmas, again, I've been reflecting on this, is because Essex and London, the only places in the country that got hit hard by the Kent variant while in a lower tier. Everywhere else was either in a higher tier or there was a lockdown before they got hit by Kent variant. So I think that was a real problem for us. And I think variants are a real issue. At the moment, there are a number of different variants knocking around. The most worrying is the South African, because the South African pretty much definitely ducks the vaccine, and that's the important bit. The most aggressive in terms of spread is actually the Kent variant. Without all these things arising from India and Brazil, what have you, none of them are as aggressive in terms of spread as the Kent one. So in a sense, because the Kent one is susceptible to the vaccine, that's probably quite a good thing now, because actually we know we can control that one. South African is the main worry one because it doesn't. Brazilian one is quite infrequent in the country at the moment, but there are occasional cases. And the position in terms of the vaccine on that is not clear. So again, that's one of concern. The Indian variant's getting a lot of attention at the moment. It's increasingly common. It's no more infectious, probably slightly less infectious than the Kent variant. It doesn't seem to be any more serious, although it's very, very early days. And again, the very, very early signs are that the vaccine works with the Indian variant, but we don't know for that for certain yet. But the early sort of in a petri dish, sort of in a test tube suggests it does work. The vaccine does work, which is good. So from that, we need to think, what should we be doing as a society? Well, we should certainly be getting vaccinated, because that's the only true protection. Of those 15, and I think this is a figure that's been quoted, so I think it's quite important to recognise it. Of the people who will be admitted to hospital, about 2/3 of them will be vaccinated, but will be vaccine failures, but they'll be from the 95% of the population that have been vaccinated, and about 1/3 of them will be the 5% who didn't bother getting vaccinated. So getting vaccinated is really, really important, and will reduce your chances of becoming ill, your chances of going to hospital, and your chances of dying. So I would really push for people to get. The second thing is to really be clear about about isolating should you get symptoms, because that's the way the thing will spread. If there are people out there continuing to go about their daily business while they're infected, so it's really important that if you're a contact, if you're a case, that you isolate. And the third thing is, there's absolutely no point in pushing your luck and going within 2 meters of people you don't have to. So yes, you want to hug your gran, you'll want to go and meet your mates in the pub, and that's all great, but you don't have to stand up right against somebody like a skinhead when you're out in the streets, or when you're kind of queuing for something or what have you. You can step back and keep that 2 meters where you can keep the 2 meters. And in fact, there's strangers who you don't know, the ones who are more likely to be infected than you are, because you presumably your family will be more concerned about you. It is possible to take lateral flow tests before you meet vulnerable people. So if you're going to see your gran, why not have a lateral flow test before you go? It's not foolproof, but it certainly gives you some sense of whether you may be infected or not, and will help reduce the risk to those people. So in brief, I think it's about as good as it's going to get. I think the rates are probably going to go up again, but they aren't going to translate into hospital admissions, and we won't know the rates are going up, because more and more people being vaccinated won't show symptoms. So actually the true rate may be higher than what we're seeing. But I think we do have to start getting back to a normal, but it will be a new normal. So I think at the moment, things are looking pretty good. I'll shut up. Thank you. Happy to take any questions on that, or the wider question stuff.
Thanks, Mike. Are there any wider questions, or should we just go straight to the questions, really, which I've been monitoring? As I should have said from the outset, apologies, that we are expecting Nikki Harris. So Pam, Harriet, if you could let me know when she joins, that would be great. She's about 15:15. I've noticed some questions coming in about staff in their third trimester of pregnancy. Mike, linked to that, I will take the question slightly out of order, sorry. There was a question about the quality of lateral flow tests. Are they going to improve? Have you got any intelligence around that?
I don't know if they're going to improve or not. I think one can assume that they probably will improve eventually, but at the moment, I think that they're not effective enough to allow people who are at high risk of being infection from being relaxed from that.
Okay, and can you then just take that forward, Mike, linking onto the question? So there's a question about, do we still need a confirmatory PCR test, which the answer is yes. Do you want to explain why that's the case, Mike?
Yeah, so that's the other way around. So there are two problems with any test, and that is the sensitivity and the specificity. So the sensitivity is how good it is at detecting the disease. And we know that lateral flow test is about 50% effective. But the other issue for the lateral flow test, with the rates of disease we're seeing at the moment, is the specificity. Now, the specificity is really good in the sense that it's about 99.7% specific. But when your rates are 14 in 100,000 and you have 3 in 1,000 that are false positives, then actually the vast majority of the positives become false positives. So the problem with the lateral flow tests and the confirmatory PCR is the vast majority, and I mean it, the vast majority of positive lateral flow tests at the moment are actually really negative. And only by taking the PCR can you weed those ones out. And that's simply because there's so little COVID at the moment. If the COVID rates went up like they were before after Christmas, then the lateral flow test is you're pretty certain if you're positive, you're positive. It's just that with a false positive rate of 3 in 1,000, if you've only got population rates of 3 in 10,000, then 1 in 10, if it's only 1 in 10 of your positive is going to be a true positive, 9 and 10 are going to be false positives. Does that make sense?
It does, but can I just ask a question then, Mike? So obviously we're encouraging, or everyone's being encouraged to do lateral flow tests, but if so many are false positives, that is extremely disruptive within schools, because of course schools are acting on LFTs, both for staff and pupils, and certainly those people are then getting confirmatory positive tests, but in the meantime, or confirmatory tests, but in the meantime, big groups of children are being sent home. So are you, what's your position on the sort of mass use of lateral flow tests? And part of that question as well is the opposite, that we're hearing from parents whose children have been sent home because a child in the class has got COVID, but they're testing negative for lateral flow tests, and parents are then saying, why can't my child come to school? So sorry, there are two questions in there.
There are a few. So it is a really difficult call because the rates are so low at the moment. But generally speaking, if you want to keep the rates as low as possible, I mean, the vast majority of people who take a lateral flow test, the result will be the right result. The problem is if they are actually infected, you're going to miss half the infections. That's the real problem with lateral flow tests. In terms of the negatives, if you are if you test negative, you are almost certainly negative. It's at the moment if you're positive, the vast majority of people who are negative will test negative, because 99.7% of people will test negative. It's just that when the rates are very low, that a lot of the positives will not be positive. But you're not going to get any more positives than you would have previously. So within a school, if you're only going to look at 1 in 300 being positive, anyway, by mistake. So.
But the problem is that you're sending whole classes or whole groups of negative children home. So is that something that can change?
I can't see how that will change unless they stop doing the lateral flow test. And I think at the moment the risks are too high, certainly this side of summer. And I actually think it's going to get worse after summer, not better. So I can't see that stopping for a while, but it's not my call. The other point is that the lateral flow test is not to be used and not of value where somebody is a contact. So if somebody has tested positive and has been excluded and is PCR positive, it's irrelevant that other people test lateral flow negative. They need to continue to isolate.
Yes, thank you.
And that's where the management of the way the schools operate needs to continue, which is why it's not changing, because obviously you then need to do the contact tracing, and in order to do the contact tracing you need to have the management of the bubbles to make that easier, because you don't have social distancing in the school environment the way you do in other parts of society. So that's why I think that there is little changing at the moment, whilst the need to self-isolate if you are an identified contact is still a feature of the system, isn't it, Mike, at this moment in time?
And I can't see that changing. I think if you're a close contact, you're going to need to isolate, and they can show that the vaccine protects you enough, or what have you. But which they did in America, but with quite controversially. But I think there will be changes as risks go up and down. But at the moment, I think that's the case. And I think as you remove restrictions more widely in the population, the restrictions in those who are exposed become more and more important, because it's only those isolation of those contacts that's potentially preventing spread within the population.
Okay, so I think, does that help to clarify sort of the overall and deal with some of the questions? So vaccination doesn't override the need to self-isolate if you're an identified contact, and there is a legal requirement still to self-isolate if you are an identified contact of somebody who's tested positive. Okay, so should we go back to the questions? And I've been informed that Nikki's also arrived, really. And Alex, I'd appreciate if you could come off mute and just help me out with some of these, and then we'll come on to the HR ones, really. So I think what we're saying in a nutshell is, at the moment, we're advising that your current arrangements really should continue. with very little change to them. I did note in the the questions that was forwarded in advance and on the chat, still questions about the organisation of children into rows. The guidance still does reference that it's good practice to organise your children into rows and being sat next to each other and facing forward. Alex, can you just remind me what we've previously advised, just so I'm making sure that we're consistent with our advice?
Yeah, I mean, the guidance is the guidance, as you said, Claire, and it does still say that the best thing to do is to keep children in rows facing front, and then there's separate guidance around things like music lessons. But if that's not manageable for your situation, then you can rearrange the children to sit in table groups. But the more you deviate from the guidance, the more risk is introduced, I suppose, is what I said. So the ideal is to sit them in rows facing forward. If it's not manageable, you absolutely can sit them in a table arrangement in the way that you would have done before.
Okay. Mike, there's a few questions here around the fact there's some coughs and colds. From Greg, can there be a precise definition of a persistent cough? Not quite, be a difficult one to do. What's your view again about reminding heads about, you know, the need to be vigilant around symptoms, but also to be balanced, really, I suppose, around COVID symptoms versus, you know, runny noses and coughs and colds?
So I've got a cough at the moment. So Finley Gogarty last week had a sore throat, runny nose and cough, and we were, yeah, the usual stuff of it is this, does he need a test, blah, blah, blah. I mean, I think it is really hard. I think we do need to stick very much by the guidance as sent from the, as given from the centre. And a persistent cough is a sort of, there's an hour plus of coughing that goes on. And then there's the issue about, you know, sort of coughs that go on for days as well. I think that if you've got a snotty nose and the kid's sniffing the whole time, they will cough, and I don't think that's COVID. I think it is slightly more nuanced than having a clear definition. I think if there's very obvious cold symptoms, cries or symptoms, it's not likely to be a cough. I think it's not an occasional cough. It is a persistent cough. It's a cough that is, you know, oh God, they're coughing the whole time kind of thing. So I think that it's hard to say exactly how many times you would cough, but I think if they're coughing a lot, that, you know, then I would think that, you know, it may, and they haven't got any cold symptoms, then I'd be concerned about it. If they're coughing every now and again, it's obviously sort of because the sniffing or clearing their throat, I would be much less concerned about it. It is hard to be dogmatic. I think they say serious cough for an hour or so. By persistent, I mean coughing, stopping for a bit, coughing, stopping a bit, coughing. So you're coughing a fair amount, not just one cough, 10, 20 minutes or something. But there isn't a firm definition.
Okay, thank you, Mike. There's a couple of questions, Mike, around face coverings. Obviously, we've mentioned around adults continuing to wear face coverings in school in the busy areas where social distance isn't possible. I didn't pick up, but forgive me, I wasn't vigilantly watching the news yesterday. I didn't pick up that there was any changes to the requirement to wear face coverings outside. My suggestion, but Mike may disagree with me here, that if you have a policy of parents wearing face coverings outside of the school gates, my inclination is to continue that at the moment. But Mike, do you want to add anything to that, or please do contradict me if you think that's wrong?
Well, so I you know, head teachers will know I've never been a great one for face coverings. There's a big deal anyway. I think that face coverings outside at the moment is probably not required. I think if it helps parents at school gates stay further apart, great. If it brings them closer together, then probably no. But I think wearing face coverings outside it's probably going to make very, very little difference to the spread of the virus, I would have thought.
Okay, so potentially schools could change that policy, but social distancing still needs to be maintained. So it's the messaging. So if you're going to suggest that they don't need to wear face coverings around the school gates, then you still need to ask your parents to keep 2 meters apart from each other.
So I think that's probably a good educative message as well, because I think that there's a thinking that once the restrictions are off, anything goes. And I think you guys pushing will actually we don't mind the face coverings, but you really need to keep 2 meters apart from each other. I think is quite a good message for people to start to pick up on as well.
Okay, all right. I'm just.
So there's still quite a few questions about bubble management, Claire, and we get quite a few of these into the inbox. It might be a good one to talk about the mixing of bubbles outside in break and lunch times. So what we've always said with this is the overriding principle is it's important to keep them apart as much as possible. So if your bubbles are mixing during break and lunchtime, they're not separate bubbles because they've mixed during break and lunchtime, and you can't then know for certain which children would be a close contact and which wouldn't. So if you've got a class size bubble, but at lunchtime they play together, that's probably a year group bubble.
So can I be unclear here that the rates are going to go up? The rates are going to go quite a lot. And there's going to be no restrictions in the community generally inside people meeting. So therefore, being able to restrict and confine those people who are exposed is going to be more important than ever. Therefore, bubbles are going to be more important than ever. I don't think bubbles are going to go anywhere. And I absolutely agree with Alex. I think the more you can define the bubbles, the less problematic it's going to be for you as a school should there be an outbreak or should people get infected.
Okay. Thank you. I think there's a couple. I mean, there was a question about expanding the bubbles. I mean, Matt, yeah, you know, ultimately the bubble management is a matter for you to determine. Again, the advice is try to keep them as small as possible, but the larger you go, then as far as contact tracing is concerned, it just means larger volumes of children self-isolating. There was a point of clarity.
I'm just trying to weigh that up.
Sorry, Matt.
So my thinking there was because we've got the enhanced provision, they've not been able to integrate at all, which is a key part of what we do. So I'm just trying to find that right balance between those kids really losing out and bubble management and trying to find a halfway house. But I think that's clear now. Thank you.
Yeah, no, that's fine. I mean, obviously the risk is that they will need to self-isolate and go on to remote ed, but that's a risk. Doesn't mean it will happen, Matt. And it's 10 days of remote ed. So you need to balance out the impact on your children now in your enhanced provision and missing out with if they are a contact as a result, then how you would support them through the self-isolation period.
Perfect.
I think that's right. I think at the moment it is a balance because actually the rates are really low, and the rates particularly in primary school children are very low. So the chances of you getting an outbreak between now and the end of the year are pretty low. So you may want to take that risk, but if you do get one, you're going to take the whole school out. And I think it's going to get harder, not easier, because I think the rate's going to go up, not down.
Yeah. And then I'm just going to close Jackie's question down, and then I'm going to move on to the more of the HR ones. But and again, I think this is correct, but Alex will jump in if it's not. So it's about, does the bubble need to self-isolate after a positive lateral flow test or wait for the PCR? So yes, you need to send the bubble home after a positive lateral flow test. If the PCR is negative, then you can bring the bubble back. That's correct, isn't it, Alex? I'm confused, everybody.
Yeah, that's it.
Because you don't know, you're working on the immediate positivity. So if the confirmatory PCR is positive, then you've taken the bubble out immediately. If it then comes back negative, then of course everybody can come back. But if you didn't take the bubble out immediately, then they could potentially be in school for 1 to 2 days whilst you're waiting for the confirmatory PCR. And as a result, you may have another positive case, and then you would end up with a potential. Okay.
And Claire, just following on from that, can I just ask a question? There's one in the chat, but we've also had lots of parents who are doing lateral flow tests when the child has symptoms. So from what's being said, I'm assuming that will then give a false result. And so can we insist on a PCR until they come back in?
So if you've got symptoms, you need to have a PCR. There is absolutely no question about that.
Quite further on that, then, if the family refuse a PCR because they've taken a lateral flow test against advice, as Harriet was saying, can they insist that the family take a PCR, or do they not allow the child back for 10 days? So this is.
You definitely do not allow a child back who's got symptoms who hasn't had a negative PCR back.
Can I ask a question, if you don't mind?
Sorry,
Can I
yeah,
ask
of
a
course,
question,
Isabel.
Claire, if you don't mind? Just about LFT and PCRs, because we've had conflicting advice given by doctors and 111 as well, where we've had a parent who took with her child a lateral flow test, which was negative, and I was told that she had to go and get a PCR test, or she was told to be advised to get a PCR test. But my understanding was if it was negative, she didn't need to. And the parent was only taking it under a precautionary measure. She didn't have a significantly high temperature. It was just a temperature. So I've always gone by what you've said before, Mike, which is the three main symptoms of COVID, not taking tests for any other reason, but that isn't necessarily the advice that's being given out at the moment. It still seems to be very precautionary, and people are saying, get a test, whatever, a PCR test, whatever.
So it is that there's a tendency to, and a temptation to do all sorts of stuff. Like Finney, when he was on my last week, we were tempted to go for a, well, we're doing LT. Well, no, you don't. If you've got symptoms, you need PCR, end of. And it's as simple as that. So if you haven't got symptoms, then you have a lateral flow test. And if it's negative, great. If you do have symptoms, you need to have a PCR. There's no kind of halfway. If you're a contact of somebody, you need to isolate. And it doesn't, no tests involved. You just need to isolate. So we do test, but that's just to see if there's any further spread required. But actually, broadly speaking, if you've got symptoms, you have a PCR. If you contact, you isolate. If you haven't got symptoms, then take your regular LFTs.
And it's still the acceptance that it's the three main symptoms that
Correct.
are published, not beyond, beyond that, because there has been this other list circulating, hasn't there, with children?
It is really hard with children, but the formal position at the moment, the simplest position, just stick with the three main ones.
Okay.
To help you a bit, of adults, because we haven't got children, so of all the people who have those symptoms and get tested at the moment, so people who have a PCR test because they've got those three symptoms, the positivity rate is 0.3%. So actually, even of those people who have tested for the symptoms, only 1 in 300 are coming back positive at the moment. So the chances of you being positive if you haven't got those symptoms, not very high.
So I think the message there also is if you want to go about your business, you need a negative PCR test. That's what will give you the confidence that if you have got symptoms that's not COVID. That's the only way you'll know about that, really. Okay.
And chances are it will be negative.
Yeah. Alex, I'm just wondering, as you know, we've been asked to put a letter together for parents. We were waiting for yesterday's guidance to come out, which I think was the right call, actually, given the conversation that we're having. Alex, I'm just wondering if we can perhaps think about doing a little flow chart to help that you might be able to put up in your school, just to sort of explain again the difference between if you're asymptomatic and you're symptomatic, the different routes around testing. That might help.
Yeah, that's fine.
I think that would be great. And if that was sort of focused for parents, Alex, so that schools could actually send that out, not only have it up in their schools, but send it out to parents, I think that'd be really helpful.
Sure. I'm remembering a little flow chart that I did with boxes for asymptomatic and symptomatic. So I think I've done one, so I'll revisit that and it's still up to date and come back. I've got one more question about bubbles, if I can go back to that one again, because I think it's come up a lot as well, that we're saying keep to bubbles, but wrap around care and after school clubs are fine and you can mix there. So essentially, if a child is in a bubble during the school day and then goes to an after school club, they're part of two bubbles. So you would have an after school club bubble, and the children in that after school club can come from different school day bubbles, so they can mix in that club, but they are a consistent grouping of children that attend that club. So they then form their own bubble, which means if any child in that bubble tests positive for COVID, you would contact trace within that bubble, and then for the person who is positive within their school day bubble as well. So if you're the positive person, all of your bubbles would be contact traced, but they're not like a bridge to, you wouldn't isolate everyone, just the close contacts of the person who is positive, but they can be part of more than one bubble. Hopefully that's helped rather than confused it, because we do get that question a lot.
I'll start that again. I'm going to ask Nikki to come in. There's a couple of questions, Nikki, on certainly members of staff who are in the third trimester, 28 weeks of their pregnancy. Can you just clarify the advice that is still in place, please, Nikki?
Yeah, so there's a few HR ones. So the pregnancy one, there has been no change to the advice that up to 28 weeks, normal risk assessment can come into work. Over 28 weeks, it's the same advice really, but it's more of an emphasis if they can't work at home, then they can come into work subject to the risk assessment. There is no greater risk of contracting coronavirus in pregnancy. There's a greater risk of severe illness over 28 weeks if they do contract it. So the emphasis is on social distancing as being a primary measure that needs to be in place, particularly over 28 weeks. I mean, there is no black and white here. There, you know, over 28 weeks, there is a greater risk of severe illness. So the risk assessment needs to have as many measures in place as possible, particularly social distancing, mask wearing where it's relevant. But at the end of the day, it's a risk assessment that you and the member of staff has to agree. They can take advice from their GP. But I've got people over 28 weeks who are saying, I want to come in. And then we've got people over 28 weeks who are saying they don't want to come in. And you just need to agree an individual risk assessment with each of those people. Pregnant people are now starting to get vaccinated. So, but vaccination isn't dictating risk assessments at the moment. They're making the guidance is that the risk assessment remains the same whether or not an individual has been vaccinated. But who knows come June and the further easing whether that guidance will change, but as it is at the moment, there is no change to that guidance.
So Nikki, at what point do we determine when their maternity leave starts?
Their maternity leave, this is a tricky one. They are not the trigger. The normal trigger is if they are ill for a pregnancy related reason 4 weeks before their due date, then you can trigger their maternity leave, but they're not actually ill related to pregnancy, so you can't trigger their maternity leave. So they take their maternity leave when they were going to take it. They have to give notice to take it earlier than the date they've said. So if they told you they were going on X date, they have to give you notice to bring that forward or defer that. But, you know, we're going to see people who are going to not be coming into work because of the risk assessment says they shouldn't be in work, who are going to go right up to their due date before they start their maternity leave. So not being able to attend work due to the risk does not trigger their maternity leave at any point. It's only if they are ill related for a pregnancy related reason that their maternity is triggered.
Thank you.
Okay.
Nikki, can I come in on that briefly?
Yeah.
Just real world example, because as you know, I'm the world's thickest head teacher. Real example being, I think actually risk assessment wise, I can get a member of staff in who is pregnant and CEV and has been vaccinated. Member of staff says, no, I don't think it's right. I'm not happy with your risk assessment. Where do we sit on that? Because the employer is saying, I think you can come in. The employee is saying, I don't think I can come in. And where do we end up with unions on this and who makes the decision? Because if I say it's safe to come in and I think, you know, we can manage most of the items to keep you safe and there's no specific guidance, then surely that member of staff is in breach of contract if they don't.
Well, ultimately and legally, yes, it's whether you want to go down that route, bearing in mind that the risk assessment is an assessment of minimising risk, not, you know, you can never be 100% sure that you've eliminated all risk. But ultimately, yes, if you are absolutely sure that you've got every possible measure in place and it is safe for them to attend work, But whether you want to go down that route with a CEV 28-week plus pregnant employee, I would advise that they seek advice from their GP, take the risk assessment to them and seek their advice. But the GP is going to say, no, they shouldn't come into work. I'm almost sure of it, which would put you in a very difficult position if you then insisted.
So again, it's just a real nightmare, isn't it?
Yeah, I know.
Okay. I know it's not your fault. It's just,
No.
You know, I'm sure there are a number of colleagues on here who have got
staff
who are in this position who can't actually do their job from home.
Yeah.
And, you know, we're on full pay for those members of staff and covering the vacancy. And we've got guidance that says CVs should be going into work.
Yeah.
Mike is saying, but you need to manage your 2 metre social distancing, but that's an impossibility within the school. We've already know that. We already have had guidance that says it's not going to happen in primary schools, you know, where possible, do it. Then you've got the metre plus that Boris comes out with. So you're in between all these places, and nobody wants to get difficult, but actually it is really tricky, and nobody is willing to make a decision other than saying to head teachers, sorry, it's up to you again to make the decision and take the risk.
Yeah.
And that's hard when we're not medical experts. So I know it's not your fault, it's just me voicing, I guess, again.
Yeah, no, it's hugely frustrating, and somebody's just put in the chat that, you know, GPs are signing people off sick or just saying they shouldn't come in without seeing them or anything. They're just, you know, I think, you know, if they're signed off sick, then, you know, at least they're getting sick pay and you might be able to claim some insurance from that. But if the GP's saying no, they just shouldn't come into work, then you've got to pay them full pay and all the issues that you've identified, Nick. It is a really difficult one, and I wish I had answers for you, but I don't.
Nick, just jumping back to Dawn's sort of technical question there, that if they can't work from home and we agree they shouldn't come into school, do they go on statutory sick pay?
No.
But
no, they're not sick.
Their GP and get confirmation that they are sick, then, or that, no, sorry.
Yeah, if they are sick, or they get a fit note saying that they're sick, then they're on sick pay. But if they just are not coming in because of they're isolating because of the risk, then they're not on sick pay. They're on the contagious diseases pay, which is the equivalent of sick pay, but you can't, I don't think most of you can claim from your insurers for it because it's isolation, not sick pay. But they're not sick unless they're signed off sick. Okay. Couple of other things that have come up. Questions about face-to-face interviews and staff meetings as is coming up. The guidance is still wherever possible, don't do it face-to-face, but there's nothing to stop you doing face-to-face as long as you've got appropriate measures in place. So social distancing, mask wearing where appropriate, you know, you're all having visitors coming in and making appropriate risk assessments and arrangements for those. So there's nothing to stop you doing things face-to-face. It's about the normal precautionary measures in terms of particularly social distancing. So that's entirely up to you. The other big issue obviously is about holidays. The first point is people should not be going abroad outside of the government guidance about where they should be going. So anyone who's planning to go to Spain at half term shouldn't be going to Spain at half term because it's on the amber list where you shouldn't be going for tourism. People should only be going to places that are on the green list. In terms of summer, people will have booked holidays in anticipation of places being on the green list come the summer, I guess. The golden rule is that they must be back at work for the start of term. So if they are planning a holiday to somewhere that has quarantine and they're choosing to go anyway, they must have completed that quarantine by the time term starts so that they can return to their jobs. But obviously, if the country that they're going to is still on the amber or red list come the summer, they shouldn't be going anyway. So the kind of message to your staff is, whatever you plan to do over the summer, you need to be back at work, not isolating at the start of term. So if you are going to book a holiday, do it early because you need to be back. I guess the slightly grey area is people who go away to somewhere that is a green country and it suddenly becomes a country that is subject to isolation. I think my view is that that could happen to any country at any time, and the message to staff needs to be, you need to factor that into your plans. And I'm not sure that anyone booking a holiday at the moment who is then subject to isolation ought to be paid for a period where they're isolating when they knew that that was a potential. I think there's enough notice and enough awareness that isolation could be introduced, that you shouldn't have to pay people if they have to isolate. I'm sure that won't be a popular view.
Sorry, jump in on that one as well. Just thinking about, we're getting this with parents as well, but I know some staff have, they previously booked a holiday in the summer holiday pre-COVID, so before COVID came out, and then when it came out, they rebooked it for the next year. This is before quarantine as such came in, so they pre-booked it for this summer, and actually if you count on 10 days, it then goes into the holiday because it then goes into term time. What and how do we stand with that situation?
Well, I think the message is clear that they are contractually obliged to be back at work at the start of term, and they need to either not go on their holiday and change it to another time, or they need to change the dates, because there is enough notice for them to be aware that they potentially won't be back for the start of their contract, and therefore they'll be in breach of their contract. So I think it's starting, and I'm going to do some updated guidance on this, but I think it's about you starting to get that message across to staff that this is the expectation and they need to think about and manage their plans so that they can fulfil their obligations come the start of term.
Okay, thanks.
So on a wider, sorry Claire, on a wider issue there for parents, and obviously Alex is going to craft a letter to parents, and one of the things we've asked about is a reminder to parents about term time holidays and that they should be taking them. But is it possible, I know it's more difficult because parents aren't under the same contractual rules as staff, but to remind parents that if they're taking holidays at the end and children therefore can't come back into school, is it possible to unauthorise that absence if they're isolating or quarantining?
So there's a difference here, isn't there, Pam, between quarantining and isolating?
Yeah.
I've had a look at the guidance, but maybe Alex, Mike and I will talk about that. But my view is attendance is compulsory.
Yes.
And therefore, if you are required to self-isolate, as in you're either a contact, you're symptomatic and have tested positive, then you are by law required to isolate, and the school is required to put remote learning on during the period of isolation. If the family go on, this is my view, but if the family go on holiday and there is a quarantine period that they know about before they take the holiday, then and school attendance is compulsory, then yes, I'm saying that I'll check this out with the attendance team, but I think that should be unauthorised. And certainly there was a comment earlier on about then needing to put on remote education. That's a family decision. They are deciding to go on holiday to a country that requires quarantine, and they have a legal duty to quarantine. That's their decision. And they are proactively taking that, which means technically they are taking their child out of school for the 10 days of quarantine.
And can we ask for some evidence of either self-isolation or the positive test? Because I know my parents, and Isabella's put the same, a lot of them will say, oh yeah, we're self-isolating, even though they're quarantining. So is there any evidence we can ask for that? Because I've already got them now. One child's been in contact with a positive case, so isn't in school, but the child told everybody on Friday they were going on holiday. So I don't really know what evidence.
I mean, that's really difficult for us to call that one generally, because it depends on your parent community, Harriet, and the only person who knows your parent community is you, really. I mean, it's like any kind of parent response to try to avoid the fine, isn't it, really? And you know which ones to challenge and which ones not to challenge when you're told that they're sick and that they return after term time holiday. It's a similar thing, isn't it, in terms of the intelligence, really? I mean, if you've got categoric evidence that they're saying that they're a contact, but actually it's a holiday thing, yes, I mean you can challenge that. It's up to you how far you push that, though, Harriet. I would treat it in a similar vein as a parent using any other reason whatsoever than admitting they've gone on holiday.
Thank you.
It's at your discretion to issue the fine, and the council will support that.
I've seen the chat. I'll do a letter for staff about holidays for you.
Thanks, Nikki. There's a few questions about transition, and then there's a general what post 21st of June and sports days. I'm going to bring Alex in on the transition, Alex, if that's okay.
Yes, there was a helpful, I'm being sarcastic, obviously, one-liner in the guidance, as I can see you all nodding, you've all read it as well. You should complete thorough risk assessment before running transitional, taster and open days. So that to me says that those activities are allowed under the guidance, and it's up to you how you best manage them. So I think my advice would be to manage them a little bit how we've said about clubs and activities as well. So consider consistent groupings, avoid mixing as much as possible, and make sure you've identified in your risk assessment how you would identify any close contacts if there was a case of any of those children. So as long as you know those things, then that's your risk assessment, isn't it? I don't think there's anything additional that you would need to put in place for those activities. Consistency, social distancing if you can, and how you'd identify close contacts.
Okay, and then tying up the sports day ones, really. I mean, it's difficult because we don't know yet whether the restrictions will be eased on the 21st of June. At the moment they're not, so you can only make your decisions based on the current restrictions, which are avoiding large gatherings, and if you do have a larger groups of people, then social distancing is required. So how are you going to manage that? I mean, if parents are basically asking you at the moment, nobody knows. We've only just had the announcement that we will be proceeding to the 17th of May. That I appreciate how difficult this is for you, but ultimately you can only make decisions based on the information that you have at this moment in time. If you can wait to delay the organising of your sports day around inviting parents, depending on when it is, how close it is to the 21st of June, that might be an option. Or you might need to take a decision, the way some of you have taken difficult decisions already about residential trips for the remainder of this term. I think I absolutely get the feedback, and we can try and articulate this as strongly as we can in the letter that we're drafting. But ultimately, you need to adhere to the advice that you're receiving from the Department for Education, and that's all you can work on at this moment. And so, ultimately, it would presume at this moment in time that under the current arrangements, you would need to limit the number of visitors coming into the school, and the risk assessment around that would need to be very, very, very strict to manage, really. I don't know if you want to add anything to that, Alex.
No, there's no specific guidance around it, so I would just be applying the wider national guidance around social gatherings and risk assessment, and the overriding guidance of keeping your bubbles apart as much as possible, and that's as much as you can do at the moment.
Would it help? I don't know. I'm probably offering something to do here that we can't. Would it help if we also tried, not in the parent letter, because I think it'll be confusing, but maybe try to just craft something that if you're getting questions around sports day, we could then maybe craft a paragraph for you to maybe put in your own parent letter, parent newsletter or whatever. Okay.
Claire, can I ask a question that I popped into the chat quite a while back, and Mike might be able to come in on this. This is around residential trips, and if you have a group who are away for a week, as Mike's saying, infection rates are going to go up and up and up and up and up, and we have a symptomatic pupil on the trip who we then take on the trip for a PCR test, because that's what we would want to do, and isolate all the children whilst on the residential trip, and then they test positive on PCR. What are the rules set around getting that trip back to school if they're supposed to isolate and they are away? That would be a really useful piece of advice to know about.
So the children have already been exposed, haven't they, to that person? So I just bring them all back on the bus or wherever, as best you can. So
that was the key point, Mike. I guess we are able to transport them back, even though they should be under isolation at that point, to get them back to. Well, they're
the same group, aren't they? They're not. So they're not mixing with anybody outside of that group,
except the coach driver.
But he'd probably been exposed anyway, wouldn't he? If
not necessarily, because you have a different coach company take them up and back. So that's the bit that we're looking at, whether or not we could get them back, because you'd have a coach company.
Oh, I see. Yeah, good question. I'll have to look at that in terms of the coach driver. But I can't see any other way of getting them back without exposing them. And let me look into that, and we'll get back to you.
Thank you. That would be really helpful.
Cool. Thank you.
We'll see if the DfE have got.
So okay, just say I've got to go. I've got an 11 o'clock. Is that okay?
Yeah. No, that's really great. Thanks ever so much, Mike. We really appreciate your time.
Thank you. Cheers now. Thank you.
Well, just on the trips, visits spot you were just talking about, we did put some guidance in comms a little while ago about risk assessment. So there was a few options. So you could ask the parent to come and collect the child who's tested positive, if that was possible. Otherwise, you'd need to speak to that coach company and see if they were willing, if that was them, and if not, then consider a taxi or otherwise for the person that's tested positive. And at the very least, you'd need to consider your seating plan for the coach, and try and keep the individual who has tested positive as separate as possible. But the best thing to do might be to ask parents to come and collect that one child straight away. And then
it's a bigger issue than that, though, Alex, isn't it? Because if that child PCR tests positive, then the whole group are isolating at that point, and so that would be 60 parents coming up in one hit to try and collect them, or a coach, wouldn't it?
No, not for the close contacts, just for the person that's tested positive, because they're confirmed to have the virus. They've tested positive, so you could ask the parent to come and collect those. And the others who are close contacts could travel back together. If there was an issue with the coach company not wanting to collect someone that had tested positive, because then them themselves would have to then isolate for 10 days, wouldn't they? So that might not be something they were willing to do. But we did put out in the comms, and we can look at that and check it's up to date and put that out again. That's helpful.
That's really helpful. So the coach driver would be a contact of a contact, unless another child tested positive, and then they would switch to being a close contact. Does that help, Nick?
Yeah, they might just find that preferable to.
Yeah, I think so. It's just that, and it's highly confusing, isn't it, for everybody? But if that bubble has a positive PCR test, then you would isolate that bubble because they could be infectious. Therefore, we're saying we could bring them back on a coach, even though they should be in isolation, because they will be effectively kept in a coach. And goodness knows what will happen to the residential place as they then sanitize it from top to bottom. But that gives me an answer and lowers a risk element of sorts. But we'll give some more instructions to our parents.
But I will follow that up with the DfE, because that does seem to be a bit of the thinking behind residential trips. It doesn't quite have been closed down, Nick. Yeah, okay. I'm conscious of the time because we were only due to be an hour, but I do just want to make sure that we have covered off at least generally most of the questions coming through. I'm just sort of going to the bottom really.
There was one question about guidance home visits. Mike Ross, I'm not sure what the question was. I don't know if you wanted to give me a little bit more information on that one.
Mike?
Hello, sorry, just trying to unmute, the button won't work. It's just whether or not home visits can go ahead. Obviously, traditionally, early years staff have been to visit children in their home as part of the induction process, but I'm assuming that wouldn't be advised this time round. I know you can meet inside as 2 households, but you'd have one teacher visiting maybe 6, 7, 8 households in the course of a morning. So I'm just assuming that would be advised against.
Okay, that's helpful. Thank you for clarifying. I did speak to the DfE about this because it's not in the guidance, so I'll read from their email. As you found, there isn't any guidance for this specific set of circumstances. However, if staff are going to be in a pupil's home, then they should ensure protective measures are in place and follow the guidance for working in other people's homes. So the same guidance as tradespeople would follow for working in the home. And I can make sure you've got the link to that because I've got it here. But I think the advice would be avoid if possible, but if you are going in, then follow this guidance.
Okay, thank you.
Okay, great, that's helpful, thank you. Alex, can you see anything we may have missed? Visits can happen, yes. Visits in the garden can happen. Outside is better than inside still at the moment, although the advice obviously will have changed as from next week. But still with the weather as it is, if you can do it outside, that's also away, and it's another protective measure. We've done the HR ones, I think. We've said that we'll pull a parent letter together and again, some support around testing for you. I mean, if schools are preempting the 21st of June, easing of the restrictions, then fine, okay, but we just don't know whether the activity can happen at the moment. And obviously, environmental health teams in the local district and boroughs will be looking at all of that very closely. We are planning for outside induction for parents groups of max 30. I don't see why not, Greg, as long as obviously, again, you might want to consider face coverings potentially, and making sure that families are distancing as much as they possibly can. But yeah, groups of 30 are now allowed, and outside again is much better. Okay, I think on the whole, Pam, is there anything you think we've missed completely?
No, I don't think so. I mean, I think it was very interesting hearing from Mike about the sort of way forward, but I am still concerned that it feels a bit like schools are being asked to manage COVID themselves and stop the spread in society. And I still, we all know how difficult it is to operate schools under these restrictions. So I think that message needs to keep going back to DfE as far as possible. But thank you obviously to Mike and yourself for
yeah, no, I don't underestimate the challenges at all, really. And we are now obviously starting to deviate, as you say, from the easing of the social restrictions vis-a-vis the protective measures that you're still being asked to adhere to. So we'll try to traverse that within the letter to aid parental understanding. I will feed that back to the DfE when I speak to them later this week in terms of that. I'm picking up the messages. So we need to be mindful of the guidance around social gatherings and the connection there as well, Alex, as well as going into people's homes and the guidance around tradespeople entering homes. So it's not just the school guidance you might need to be cognizant of now. It would be the social gathering guidance, particularly for bringing groups of parents together and what that would look like, and also going to people's homes. I mean, I do get the message around it feels very tight for us and the world is freed up around us, really. I think what I would say to that really is I'm trying to get this across positively, and it might not come across that way, so forgive me. You know, ultimately, I think the government are basically saying they want to keep you as safe as possible so you can stay open to educate your children, and that's the priority. And so, yes, a theatre may open up, and yes, there might be a positive case, and yes, 50 adults might need to self-isolate, but that's 50 adults self-isolating because as a result of going to the theatre. You know that if you have an outbreak in your school, that could be a whole year group, maybe more, 2 year groups. Some of you have experienced that already. So just, you know, when you're getting all these questions and it feels really challenging and it feels really hard, that the notion of all these protective measures is to prevent, as far as possible, COVID coming into your schools and to ensure that you can continue to do your core business, which is educating your children, which is absolutely so vital given the amount of learning some of your children have lost due to the lockdowns. You're all doing an amazing job. Keep that in your mind when you're sort of getting a bit weighed down with lots of questions and lots of queries. It's about keeping you open, really, and trying to keep you as safe as possible for you and your staff and your children, so that you can continue to function.
Thank you. Harriet, do you want to wrap up?
Yeah, the only thing I was going to say, and I might have missed this, but on the questions that you sent out, Pam, there was one about swimming 25 metres by the end of primary. Is there going to be any, do we know if there's any comment from the DFE around that, or are we still expected to report that or tell that, or I don't know?
I'll follow that one up, Harriet. I've not seen that one before. I mean, it's like with everything at the moment, you know, ultimately, if as a result of children not being in school, that gets missed, it's one of those things. It goes on the list of accomplishments that children haven't managed to achieve as a result of the lockdown. So again, I would put a very pragmatic response to it, but I will see if the DFE are actually going to put something out nationally around that, Harriet. But my response is the same as with all learning. If it's as a result of not being able to attend school and the impact of the lockdowns, it is what it is. You can only do what you can do.
No, I agree. So thank you to Claire, Mike, obviously he's gone, and to Alex. I think you've given us some clear guidance and some good suggestions for us to carry out. I totally agree that it's about protective measures to stop the infection coming into school and ultimately enabling us to keep school open. So, you know, I suppose that's what we have to keep in our mind when we're doing our risk assessments and having those parents banging on the door that this is not fair and that's not right. And, you know, we have to stand by what we know is right to protect our children and staff. So again, thank you, Claire and Alex. Appreciate your time this morning.
Thank you. Take care, everyone. Stay well. Stay upbeat as much as you can. Remember the laughter at the beginning of the meeting. So try and sustain that as much as you can.